Hi, this is Dr. Ravi Mohanka, the Director of Liver Transplant at Sir H.N. Reliance Foundation Hospital in Mumbai. This is the Alcohol Awareness Month, and we are going to talk about how alcohol affects your liver and how to avoid getting liver damage because of alcohol. So, first of all, what we need to understand is that almost all alcohol that is consumed by any person, or for that matter many other metabolites that are consumed by a person, they are all metabolized in the liver. So liver is the main factory that detoxifies almost everything that we eat and that goes in our body. But there is a limit to how much alcohol can be processed and metabolized by the liver. Typically in medicine we have a unit thing called as 1 unit of alcohol, and typically one person can metabolize 1 unit of alcohol in about an hour. So if there is a person who consumes 1 unit of alcohol over an hour, then it is likely to get processed or metabolized. But if a person has 3 units of alcohol in that 1 hour, it will not get processed and it will remain in your blood and increase the blood alcohol level. On the other hand, if the same person drinks that 1 unit of alcohol over 3 units of alcohol over 3 hours, then it will probably get metabolized. So not only the quantity but also speed of alcohol intake is very important when you look at liver disease. So what is 1 unit of alcohol? Now, a lot of patients will come to you and say, I didn't have alcohol, I just had beer. So that's not true. Beer, whether it's mild or strong, or wine, which is about 12% alcohol, or a hard drink, they all have the same amount of absolute alcohol and will cause the same amount of damage to the liver depending on the quantity ingested and over what point time it is ingested. There are some people who also have an impression that if you drink expensive alcohol, then it will cause less damage to your liver. Unfortunately, that's also not true. So there are two types of alcohol consumption which are dangerous. One is prolonged consumption of alcohol consistently without breaks, and two is what is called as binge drinking, where you consume a lot of alcohol, a large quantity of alcohol over a very short period of time. Both these can cause either liver cirrhosis, which is permanent damage to the liver, or alcoholic hepatitis, which is sudden worsening of liver function because large quantity of alcohol use. How to prevent it? Two main things. One is give breaks. So for every few weeks of alcohol use, you should give a few weeks of break for the liver to recover. Liver can recover from alcohol damage or any kind of damage with these breaks, but once there is cirrhosis of liver, then that recovery is very unlikely and the damage is generally permanent. And therefore, in order to avoid any damage to the liver, it has to be done at low quantity, which is about less than 3 units of alcohol per day for less than 10 years, or for women it's about 2/3 of that, and to avoid binge drinking. Now, if somebody does develop alcoholic liver disease, how do they know? They may have symptoms such as jaundice, some swelling over their feet, some swelling in their abdomen or belly, or they can even have confusion, or in severe cases blood vomiting. But in most cases these symptoms are going to be seen only in patients who have very severe liver disease, and therefore it is important that you intermittently check your liver function tests, including an ultrasound of the liver and a fibroscan, to know if there is any damage to your liver. And if there is some injury to the liver or some damage to the liver, please take steps to reduce or stop alcohol use early. I hope that everybody is able to take care of their liver well and be aware of how alcohol can affect the liver and prevent damage to the liver because of alcohol. Thank you very much.